Hi, my name is Lynn Leach with Intuitive Hands Physical Therapy in Boulder, Colorado, and today I'm going to show you how you can take care of your C-section scar. Once you get the okay from your doctor that your scar is well healed, it is very important for you to start massaging that scar in that whole area. We're going to talk about it as having 3 different layers, and I'm going to show you exactly what you need to do in those different areas.
If your scar is newly healed, you will want to work above and below the scar, and you're going to move the tissues up and down and side to side, looking for the tissues that don't want to move in a certain direction, holding it in that direction until you feel it release. Then you can do little circles, moving the tissues around the scar in little circles, working from one hip bone to the other hip bone, working the whole area around the scar. Then once your scar is less tender, you can put your fingers right on top of it and move your fingers like you're playing a piano, seeing what area of the scar does not want to move and then focusing in on that area. Then you work the scar as a whole, moving it side to side and up and down. The last thing you want to do is to pick up the scar between your fingertips and try to roll it. This releases the skin from the layer below it. To work the second layer, the muscle layer, put your fingers directly on the scar and allow it to sink in until you can feel the muscles below your fingertips, working the area up and down and side to side, and holding the area that doesn't want to move in that direction until it releases. To access the third layer, it's very important for you to bend your knees up to allow you to sink in deeper into the tissue. You put your hands on the scar and you sink in as deep as you can, doing the same movements of up and down and side to side. Again, seeing what area doesn't like to go that direction and focusing in on that area. Also, cup your fingers and allow them to sink down on either side of your pubic bones. Again, doing those same motions. Really try to lift the organs up and hold it there and then move it side to side, checking for what area doesn't want to move and working in that direction.
Ideally, you should work on your scar tissue area about 5 minutes a day, working on the 3 layers, making sure the left side can move as freely as the right side. Once the tissues are fully released in all 3 layers, you'll want to check in with your lower abdomen about once a month to make sure they continue to remain mobile. As scar tissue can form for up to 2 years, it's important to continue to check in with this area about once a month for those 2 years. Now, some other tips. The third layer is the most important layer, so make sure you sink in as deep as you can, working those tissues from side to side. Freeing up this deeper layer can help you prevent future low back problems and bladder problems. So that's what you should do to manage your C-section scar. Please feel free to contact me if you have any other questions, or you can also find a women's health physical therapist in your area to have them help you work on your C-section scar. Good luck to you.